Welcome back to my YouTube channel, everyone. My name's Emily Cheng, and welcome back to ExploRN EmCheng. Today, I'm going to chat a little bit about working in MedSurge as an ICU nurse and do a bit of a parody video at the end. Just a little bit of a background. I am a travel nurse from New York, and I primarily work in CVICU, and right now I am on my second assignment here in California. I am currently working at one of the biggest hospital systems here in California, and they are notorious for floating their travelers every 4 hours. And yes, you heard that right, every 4 hours. I thought that when I was signing up for this contract that it was, not gonna be every 4 hours, but it has almost been pretty routinely every 4 hours. I want to say probably 80% of the time, 75 to 80% of the time that I've worked there so far, I have floated every 4 hours, and it's been a bit of a challenge, especially because they don't only float you to like units such as a general ICU. Me working in CVICU, I thought that I was only going to float to general ICU, which is for them, it's a MICU and CCU, which I'm totally fine with. However, this hospital and also this hospital system in general notoriously will float their travelers to tele floors and, worst of all, MedSurge, which I have never worked in telemetry before. I've never worked in medical surgical, so I don't know how to manage having more than 2 patients. So I've floated to MedSurge a whole bunch of times already. I've been break nurse, I've been a sitter for a 1-to-1, and I've also had an assignment in MedSurge. So it's been very different learning all these different roles in MedSurge, which is a completely different specialty and unit than I'm used to. And I've had some interesting experiences so far. The good thing about the hospital that I'm working at is that the MedSurge nurses only take up to 5 patients, which in New York you would never see that. All my MedSurge friends, they always have anywhere from 6 to 7 patients, maybe sometimes 8, which is just out of this world insane and super unsafe. But here they have a max of 5, and the nurses never get slammed with more than 5. And if they are on a MedSurge floor and their patients are on telemetry, they will only have 4 patients. So it's really manageable, but at the same time, I just don't know how to manage more than 2 patients. More than 2 patients, I'm already like, I don't know your name, I don't know your diagnosis, I don't know even what room you are. So usually I just organize it in my brain as, patient in room 1 through 6 or 1 through whatever. I feel really bad because I liked addressing patients usually by their first name or their last name, and I really like to remember them that way. But when I have that many patients, there's no way that I can remember their names and their room numbers and their diagnoses. There's just no way. Working in MedSurge has given me a new appreciation for MedSurge nurses, especially for my friends. I'm calling you out right now because I know that you guys have worked hard. We as nurses in general work hard, but it's just such a different kind of workflow that I'm not used to, and I really, really appreciate everything that you do. You guys work so hard, and it's so difficult to be able to organize all the information that you have about so many different patients. And just know that I appreciate you, and your job is so difficult, and I appreciate all that you do for your patients, and I understand how difficult it is to manage so many different patients. Here are some of the funny thoughts and parodies that I had working in MedSurge in the ICU mindset. Get ready to laugh. So you have patients 4201, 4203, 4204, 4205, and 4208. Yep. Okay, report. Neuro, respiratory, cardiac, GI, GU, skin, access, drips. 4201 is a full assist. They have a caregiver in the room and they pee. Okay. Oh yeah, there's none of that here. 4203, they are a 1 assist. They get up and they're a feeder. 4204 is just a feeder and they poop and they're bedbound. You good? You good, right? Okay, see ya. Bye. That's it? Wait, but what about their lines? Are they a full assist? Does PT come follow them? Does OT come follow them? Do I have to feed them? What about their family members? What about psychosocial? Do they walk at home by themselves? Do they use a cane at home? How are they to the bathroom? Oh my god, they're not on a monitor. What do you mean they're not on a monitor? I can't see their heart rhythm. I can't see their heart rate. I can't see the blood pressure from the monitor. What do you mean? What do you mean I don't? What do you mean I can't see what they're doing? I don't understand. What do you mean? So 4203 wanted their door closed, so I just closed it. What do you mean they wanted their door closed? Like all the way closed? Like there's no windows, I can't see into the room? I can't see what they're doing at all times? What do you mean? So I just dumped the urine in 4208, okay? Okay, do you remember how much urine it was so I can document it? Oh, no, I didn't count it. What do you mean you didn't count it? You mean there was no hat in the toilet? Like there was nothing to measure it? Was there a cylinder or anything? I don't understand. I only have to do one assessment for the entire shift. I only have to do one assessment. Really? What do you mean they can just ambulate in the hallway? Like without a monitor, without me, without a person? What about their IV pole? What do you mean they're not really on an IV pole? What do you mean they're not really on drips or fluids? Really? Hey, so when do you want to take a break? Okay, cool. Yeah, I'll write that down for you. Okay, awesome. And everyone's got their own breaks, and MedSurge really isn't that bad. I know all these people always say that MedSurge is really bad, but it's been pretty uneventful, and I'm just breaking these nurses for every 30 minutes, so it's like I don't even really have a patient. You know, everyone always says MedSurge is so busy, but it's really not that busy. It's not that bad. Hey, do you need any help in there? Okay, I'm coming in. What do you mean your patient's unresponsive? Sir? Oh my god, there's no pulse. Get me the crash card and call Code Blue now! I hope you guys enjoyed this little parody of mine that I did on my thoughts and experiences as an ICU nurse working in MedSurge, because it's very, very different. And I always say that any experience is good experience. So I'm really trying to stay positive during this entire experience that I've had so far. And I think that is the key to surviving in MedSurge. Just going with it and learning on the go. I mean, that's nursing in general, right? I hope you guys enjoy this video, and I'll see you in the next one. And as always, let's go exploring.